All right. So, welcome everyone to today's community conversation, More Than Words, a conversation about leading and supporting a multilingual workforce. My name is Sasha Sensor, and I'm Anchor's Director of Education. And again, if you weren't with us earlier, I could not be more thrilled that you all have felt that this is an important way to spend an hour of your very busy week. So, thank you for joining us. And it's going to be a little more than an hour because we like to give space for these conversations. But remember, this will be recorded, so you can always come back if you need to. All right, so today we're not just talking about language as a skill, we're talking about language as power, as access, and as identity. And because when we show up to lead and support a multilingual team, we're not simply translating words, we're shaping systems that determine who gets heard, who gets trusted, and who gets to belong in that particular space. And as we know, a multilingual workforce is more than just a demographic shift for our space, it's an asset. It's a reality of our present and the promise of a more inclusive future. But too often, our structures that we've been in for many years, and sometimes our leadership practices and even our good intentions haven't kept up with the pace of the reality of the workforce. And that's why we're here today. So, this isn't a session about fixing language barriers. It's about how do we dismantle systems within our organization that result in language differences being a barrier to success. And we're going to ask some hard questions, and we're going to talk about building organizations where language is treated as a bridge and not a wall, and where speaking more than one language is a strength, not something that needs to be managed or tolerated or worked around. And because here's the truth, language is infrastructure. I just want to say that again. Language is infrastructure. If it doesn't work for everyone, the whole system, the whole organization can suffer as a result. And in our field, in disability services, in human services, in care work, when language doesn't work, people can fall through the cracks and employees get misunderstood, people accepting supports and services get misrepresented, and trust gets lost. And that means our mission gets diluted. So today we're going to go beyond the basics of language access and dive a little deeper into the following. First, how we meet people where they are. Second, trauma and trust for staff navigating life in a new country and a new system. Three, practical strategies that work from peer-led onboarding to community partnerships. And last but not least, but perhaps the biggest question of all, are we treating language as an asset or an obstacle in our organizations? So before we begin, just a few housekeeping items. Number one, as I mentioned earlier, the session is being recorded, and we will share it with you through the Anchor Connected community next Wednesday. Number two, you do have access to live captioning, um, but it is AI generated. So just know you can find that within your Zoom, either through the traditional CC or going to the More section and turning that option on for you. And then we also ask that you use the Q&A box for your questions. We have saved time for this at the end. We encourage your curiosity, but as we like to say at Anchor, especially in these conversations, if you can Google it, don't ask it. We're looking for really more in-depth context of like higher level generative thinking. And we know that these experts who you have here are going to give you more information than an AI quick search ever could. So if you can do it through Google, just don't ask it today, but save the big picture questions for this conversation. And then last but not least, you can see us, but we absolutely cannot see you. And we know that this is awkward when it comes to human discourse and conversation. So if you've been to one of our community conversations before, you know we ask for thumbs ups when you like something, showing a little heart when you love something, any way that you can use the emotions or the emoticons to get us on board. And thank you. I see that we have already discovered those buttons. So this is a great start to our conversation today. All right, with all of that, I have taken up the majority of our first 5 minutes together, and I'm going to start to turn it over to our amazing panelist who will be joining us today. So, first of all, let's begin by understanding that the voices who are joining us today both live, shape, and lead the change in this particular space for our field. And each of our panelists brings not only expertise, but deep experience navigating what it means to lead, support, and thrive in multilingual workplaces, especially in the context of disability services, care work, and community-based supports. I'm asked each one of them to introduce themselves and respond to a guiding question that we have for the day. That guiding question is, why is language more than just communication in work? Why is language more than just communication in work? And what does a multilingual workforce mean to them? Before we get started, you will notice that we did say that we were going to have 4 panelists joining us today. Unfortunately, Jerry McCandless had an unexpected family event come up. She's quite all right, but just couldn't join us today. So she sends her regards to those of you she knows and loves so well, and hopes that she can be available next time that we engage. So with that as a place to start, you're probably going to hear a personal story. You might hear a lesson hard won through leadership, but at its core, each of the reflections we're going to highlight today is going to shape how language teaches us about trust and opportunity in relationships. So let's begin. Regina, would you mind starting us off, answering our core questions and introducing yourself to our audience today?
Thank you so much, Sasha. First, I want to express my gratitude to all of you, one, for inviting me into this space and sharing space with me and sharing your thoughts with me. And I'm really excited not only to contribute, but also to learn from you all. I always look at an opportunity to learn. And so I'm really excited about that. I want to start by explaining that I went in and changed my name because I think it's important when I'm listed on multiple websites to see that you can either find me under Regina Rodriguez or Regina Rodriguez Cisneros. So I made that clarification in my name for you all. And it's a long name, and most times I respond to Reg. So if you're comfortable just saying, "Hey, Reg, I have a question," I'm totally comfortable with that. I'd like to start by first physically describing myself for you all. I am an Indigenous Latina female. I have my hair pulled back in a ponytail, and I'm wearing red glasses, and I'm sitting in front of a backdrop that is a color, a blue color shade, teal color, that has NASDDDS logo in the, for me, it's the left, but I would imagine for you all, it's the right corner. And my pronouns are she, her. And I come to you today. I am the Director of Systems Innovations for NASDDDS, and that's NASDDDS, the National Association of State Directors of Developmental Disability Services. And at NASDDDS, we support state directors with initiatives, policies, and processes. And as a Systems Innovations Director, I look really carefully at supporting organizations to ensure that we're thinking creatively, that we are honoring innovation so that we can make sure that we're not getting stagnant in old processes that are not relative to our most current landscape and or our most current communities. So that's where I put my energy. I live in Colorado. NASDDDS is in Alexandria, Virginia. So I go back and forth and travel across the nation to support all of our members. Just to give you a little bit of personal background about myself, I am an ethnic studies major, and I'm finalizing a master's in social sciences and humanities. And I'm also a graduate of the Georgetown University's National Cultural and Linguistic Competency Organization. The cohort is no longer in existence, but it was a very fruitful process for me to be part of that cohort and really to be intentionally embedding cultural and linguistic competencies into all of my work. I'm also a JFK Land alum, and that was really important for me to be in touch with what communities and individuals living with disabilities really have as their priorities and their needs. And then I'm a mother of 9 children that range from the age of 13 to 30. and seven, well, soon to be 7 grandbabies. And the reason that I give you those details is because I think it's important for you to know that a couple of my kiddos are living with disabilities. And so I have the perspective coming to you of lived experience as a mother navigating systems. I have the perspective as a professional navigating very complex state bureaucratic systems and understanding where we see some barriers and where we can see some potential for growth. And then I also have the perspective from an academic position of understanding various communities and ethnic races and incorporating that into the big question today, which you alluded to, Sasha, and I appreciate so much, is the power, access, and identity, and language being the infrastructure. Those two pieces, when I read how they were wrote into the description of today's work, are so important to me because I know that without language access, we take power away from people to be able to self-advocate, to be able to advocate for their families, to be able to contribute to policy development and process development. We take that power away. And so if we want to make sure that we are supporting and empowering communities and individuals living with disabilities and individuals supporting those living with disabilities, it's imperative that we create access in a way that aligns with their identity. So I just wanted to say that I'm really excited to be here and really excited to have an in-depth conversation with you all.
Thank you so much, Regina. Oscar, could you introduce yourself to folks?
Hello, everyone. Thank you for opening this space. I think I'm same as Regina. I feel super honored to be part of this conversation and share a few lessons learned from what my team is working on, which I'll go in depth a bit. But my name is Oscar. I am located in San Diego. For giving a description of my picture today, I am a Latino male with a black shirt with a white background with options for all writing on it, or the logo for our organization. And for my team, we're currently working with a grant from the California Department of Developmental Services. And grant is the Service Access and Equity Grant. We are part of our project, or our mission is to increase the number of clients who are Spanish speaking. By association, we're also trying to increase the number of staff that can support our clients. Options for All, we are a nonprofit that serves clients all throughout California, Bay Area, Inland Empire, San Diego, and Imperial Valley. And we do that in different day programs like community engagement, tailored day services. And part of our grant, we're trying to increase, again, provide more services to more clients in their native language. I'm very proud of the work my team is doing. Some of them are watching us today. And I'm very, very excited to share how we are helping Options for All shift from a monolingual organization to a fully bilingual that can support our clients, our staff, and everyone in between. So thank you for having me today.
Absolutely. All right, George?
Thank you, Sasha, and thank you for all the panelists here today. And I'm very also excited to be part of this wonderful webinar. I'm so excited to hear the whole discussion, experiences, and best practices. So my name is George Budagu Makoko. I'm the Director of Residential Services here at Serenity Residential Care. It's a community, it's an organization that is here in Maine that provide service to IDD. And what I also do, I'm the president and also founder of Ladder to the Moon Network, which is a nonprofit organization that I started back in 2016. And in 2018, I started a local newspaper called Jumbo Africa. And recently I was nominated to be the co-chair of the Council of the Office of New American here in Maine, which is a new program at the Governor's Office of Policy Innovation and Future that aim at making sure that the immigrants are integrated here in Maine. A little bit of my background. My background is very eclectic, and I was born in DRC Congo, grew up there, and then moved to Rwanda after genocide in 1994. I also moved here in 2002. I'm married and have three kids, 2 boys and 1 girl. I grew up speaking several languages, including Kinyamulenge, Kinyarwanda, Kirundi, and Swahili, and Lingala and French, and other dialects. And when I settled here in Maine back in 2002, as like any other immigrants here in America, but also elsewhere around the world, if you don't speak English, one of the highest mountain you have to climb is language acquisition. I began climbing that mountain back in 2000, specifically in June 19, 2002, and I'm still climbing right now as we speak. And every day I learn something new, but it's been a very wonderful process to grow in English and speak English. And so I'm very keen into helping people who can't speak the language, because as we say, the language is a power, language is access, language is identity. When you don't speak language, you lose a chunk of your own identity, and anything else can happen in between. I'll tell you a little bit of my story about English. Growing up in Congo, and specifically in high school, we had a chance to learn English. I mean, it was an option that was there for everybody to access, but little did we know that we'll ever use English. And I remember vividly the story that we'll tell every time we had an hour of English, we were all like, let's just take an hour for going out, doing something fun. Who cares about English? And I had no idea the one time in my lifetime I will ever have to learn English and use it professionally, and without language, without English, I was unable to function at all. And there's a saying in my tradition, they say in Kinyamulenge, was as I get somewhere where a baby cries and mother cannot hear. And it goes in Kinyamulenge, that was the story about English learning here in America. And since then, I've made it personal goal to help people to improve their language. And I see here in Maine, we have people speak Portuguese, Spanish, we have people who speak Swahili, Kinyarwanda, Kirundi, Kibembe, and other multiple languages. And every time I meet somebody who's struggling to even read a letter that's been addressed to them, and I really take it personal and I try my best to help them. And my hope today is that we walk out today here in this webinar with the intention and with hope, or with the goal to help somebody who's still struggling to learn English. So I'm very excited to be here, and I'm looking forward to the next step of conversation. And thank you.
Wonderful.
Yeah.
Well, I'm so glad that you're joining us. We've gotten to know each other through several platforms, and I appreciate that you have very vulnerably shared with me that your frustration about being highly educated and yet unable to fully participate in American systems that don't recognize your strengths as a result of not having the language acquisition that seems to be expected of individuals, as well as the challenges of getting credentialing, even if you have met the highest levels of credentialing in other countries. So today, could you share a little bit about what it feels like to show up with so much experience and still be treated as less than as a result of not having as much English language development as people expect here in the United States? And how can employers shift to recognize this cultural mismatch as their challenge to solve and not necessarily the employee's challenge to solve?
Yeah, thank you, Sasha. That's a question that I've been asked many times, and I get passionate when I'm trying to respond to this. And so one thing that I'll start off with is many immigrants come from different backgrounds. You all know that, some highly educated and some are not educated. That's a fact. And some speak English. We've had people from English-speaking countries, from like Ghana, from Uganda, from Kenya. They speak very good English, and those probably have less problem than more than others. And for the ones who cannot speak English, let's say coming from French-speaking country or Spanish-speaking country or Portuguese Spanish country, when they get here, and because they can't speak the language, they are quickly seen as people who are probably not educated because they can't communicate. What else can you express yourself, or can you share your background if you can't speak the language? So they are a little bit quickly lumped in together and seen as uneducated. And this oversight creates serious emotional trauma for many refugees and immigrants. And that's where the work should start from. I'll share one example. I have a friend of mine, his name is Norbert, and he came here in Maine. I think it was in 2007. And back home in DRC Congo, was a medical doctor who's practiced medicine for many years, for decades, and had surgeons and did all kinds of practices in medicine. So when he got here, of course, after just escaping the war and the conflict in Congo, came here and he was trying to settle and getting a job. And the first job that he got, it was DSP job. And one of the requirements as a DSP, you gotta have a CRMA and being able to give medication in more safe and safe way. And so he is a doctor who's very skilled and dedicated and who's led regional health groups, businesses and organizations. And now sitting in 40 hours, training where he had to be taught about medications and how to safely administer medication. And he walked out that day and I was talking to him and he said, I'm being traumatized, like really being like pushed into a situation where he had to relieve the whole trauma of losing the whole thing that who you used to be proud of, now sitting in front of a nurse practitioner who's teaching a doctor about how to give medication. And and I'm sure within the DSPs that you have all the leaders who are here leading organization and organization, you probably have someone like a Dr. Norman. And what is missed is how do you make sure that somebody with higher skills is helped to move from point A to point B? And that's I think the call or the challenge that we should have ourselves. And how do we know that? Unless we engage with them in a very nice and conversational way and trying to dig down and see what potential they have, what background they have had in the past. And then from there, you can start quickly realizing that now I'm dealing with somebody who is highly educated with a lot of experiences, and how can I help them just break through the language barrier? Maybe they're helping them by accessing ESL, somewhere they can go and learn English and like intensive English and quickly start using their skills and move to the next level of their career. And that's something that I've seen over and over. I've seen ministers back home. I've seen senators back home. I've seen pharmacists back home. And I also tell one story. When I came here in 2002, in 2003, I got a job at a factory, and I had a friend of mine who we were colleagues back in Rwanda. He was a pharmacist, and so he had a supervisor who had no idea that he's dealing with somebody who's highly educated. And he approached him and said, "Do you know how to write?" And he said, "Yes, I know how to write." And he was trying to tell him to number the boxes of chicken that were around and making sure that putting them in order and telling him how many boxes are there. So he went out. When we went out for break, he was telling me, like, "Do you know that my supervisor asked if I know how to write?" I was very offended. And I told him, "My friend, he doesn't know you. How else would he know that you are educated unless you've had conversation and we communicated that you are educated? He can't tell, you can't tell him." So it's just like miscommunication right there. And that's a person or a friend of mine. He's become a doctor pharmacist now, and also PhD, and he's a professor here in the US. So those stories inspires me to tell, like, there's something buried behind the language. And who can break that barrier? It's us, the leaders, by developing policies and programs that support those people. Sorry, I get passionate and I can stop.
No,
Yeah.
your passion is justified, right? Like, I think all of us at some point in our lives have walked into a space where we've been underestimated. And we know what that pain feels like. And if we can get back to that place for a moment and then think about what that feels like on top of all of the other trauma that individuals who are coming as refugees or immigrants to this country may have experienced, um, we can garner empathy, right? And I think being empathetic leaders is really important.
Yes.
And learning from each other. And part of in that learning, one of the things that I have come to know is that in many Indigenous, Eastern, and immigrant communities, Western terms that we take for granted, like disability, autism, mental health, might not even have a direct translation into the language of your employee, because some of these concepts don't actually have direct cultural translation. So when we look at our systems and assume that there are shared definitions of what we consider basic health concepts, right, around health and consent or independence, they often miss the mark entirely because we're starting from a place where we're not even in standard language agreement, right? So, a lot of times what we find is this lack of knowledge around America's very complex healthcare system often results in various presumptions about an individual's cognitive abilities, their skill, etc. And Regina, you have really become passionate about this particular topic. And I really want to give you the opportunity to dig in more with all of your learning, both in academia and as your life experience. So, as we know, and we've been talking about, in many cultures, care is communal. It's not necessarily individual, and disability isn't defined the same way that we do in the United States' medically focused language and jargon. So, how do you see Western models unintentionally erasing or invalidating those worldviews, those communal worldviews? And what would it look like for our systems to honor cultural ways of knowing without compromising, obviously, the importance of safety and accountability?
Thank you so much, Sasha. First, I want to thank you so much for sharing those stories, Georges. I mean, they're so important for us to really hear about some different experiences so that we can execute what you just introduced, Sasha, which is empathy, right? Empathy is at the foundation of cultural humility. Without empathy, cultural humility don't work, and without cultural humility, empathy is going to be compromised. And I define cultural humility as a muscle. When I talk about it, when I spend in-depth time working with a team to define what cultural humility means, I explain in my perspective, I view it as a muscle, equally as important as my bicep, so to speak, to be able to lift something. My cultural humility muscle has to be strengthened, and we have to commit to working on it. We have to commit to continuous learning and recognizing that new Americans have new experiences. Also recognizing as we're introduced to diverse communities, whether we're talking about a community of new Americans, or we're talking about a rural community, or we're talking about what has just evolved, which is new communities related to COVID state shift. And I ask us to really take a moment and think about our current state demographics and look at what did they look like pre-COVID and what do they look like post-COVID? And do we have new communities that are evolving as a result of that? So when we're thinking about empathy and cultural humility, and we're thinking about cultural recognizing linguistic and cultural needs, that we should be thinking big picture about all of those different types of cultures that exist in our states. And I think that you talked about disability, and that word in and of itself oftentimes does not exist in communal cultures. For example, and I'll speak from my culture, in many Indigenous communities, don't have the word disability, don't have the word Down syndrome, don't have the words autism. Those are just examples of words that do not exist in our language. And to make that even bigger, if the word is introduced and defined to a community, the perspective of what disability means and how individuals are or are not supported in communities, that doesn't translate. Then take it even bigger, right? Think about our healthcare infrastructure and our health literacy in our terms. One of my babies lives with epilepsy. And when I'm working with neuroscientists and physicians and their support staff, they are speaking a language that as a fluent English speaker, I don't get. And oftentimes I have to say, hold on, you said this and this and this, and I got this. and they're not like jiving. So is there a way that you can teach me your language? You can empower me to know what you mean by these terms. And that's what many communities who are learning about our language infrastructure, our healthcare infrastructure, our cultural infrastructure in the United States, we have to recognize that they need the same type of empowerment, the same type of support. And one of the humilities that we have to recognize is that many cultures, the type of advocacy skills that we present in the United States are not cultural norms for many cultures. For many cultures, leading through humility and recognizing that there's hierarchical processes and hierarchical dynamics, that's very unnatural for some cultures to chime in, to interrupt, to become very what they would assume to be very dominant in the conversation. So sometimes we have to invite people into our space, invite people into the art of advocacy, and help people to understand that it's important for them to tell us what they need. It's important for them to show us that we're not connecting and we're not speaking the same language. Some of the disconnects that we create in our infrastructure are not honoring plain language. That's important to recognize that tool that we have, that concept that we have in the United States is important because not everybody speaks with spoken language. Many of the individuals that we support in our disability communities don't have spoken language. And so it's important that we recognize that we have to support them in whatever modality that services them being able to contribute and being able to ask questions and to ask for clarifications and to advocate, that we support those. Also, we have to recognize that plain language means a lot when we're translating our documents and our resources. And I give you that as a tangible outcome because prior to working in the IDD field, I worked in supporting individuals with brain injuries. And I really saw a disconnect in the languages that was being presented on forms, on even policy implementation for individuals who were charged with enforcing or implementing policies and processes. There was a disconnect in the language being used. And so it was important that we also recognize that even though we know that it's not good practice to have a kiddo be a translator for an adult, that's the reality, that many of the children of homes that's first language is not English, and then the kiddos who are the English speaker are little guys and girls, and they don't have sophisticated language. And so if we use plain language, I recommend fifth grade language. Obviously, it's important that you go back to your state and your organization and to see what their policy is. But fifth grade language, so that a kiddo, when they're helping a parent navigate a form or even navigate a website to get to you, that is in a language that a kiddo could help a parent navigate or a family member navigate. And so I lay that as two really important pieces. The other piece that I wanted to introduce to this conversation today is pretty much what Georges and Sasha alluded to, but I want to define it, and that's transcreation. And that term transcreation means we're not translating just to translate, because it's important that we recognize that because I just talked about that many cultures don't have certain terms in their language, so they don't have the concept of what you're saying when you give them the term. So it's important that we recognize that we need to present that perspective in the way that it works and operates in the Western infrastructure of healthcare that they're entering into. So if we start rattling off Medicaid terms, for example, and Medicaid forms, for example, many individuals come from a society that doesn't have an infrastructure of Medicaid. So we've just introduced a new language, right? And so it's important that we empower communities and individuals to know what is our language that we're introducing. And I say that even as I'm talking about rural communities that have not been introduced to bureaucratic systems, for example, reservations in our nations of individuals, when many only a small percentage of indigenous communities live on reses at this point. So that means they're going into big communities in our states. And that means when they enter into those big communities, they're also being introduced to new bureaucratic language. And so it's a matter of really empowering people. So I included an article, and I got permission from Sasha and Ali with their blessing to share this article about transcreation. And in that article, it defines translation is to transcreation what copyright is to writing. So we have to remove that copyright and think about writing with description and bringing to life the new words that we're offering to new communities who are using our language and empowering them. And I think that's important to do in a way that is tangible. So when we're working with a new community or new individual, and we recognize that we're doing this, giving them a paper printout. These are what the words mean in plain language. Take this home, because just because they met one care coordinator, just because they met one case manager, one person referral specialist, they're going to go out, and we know this as moms supporting kiddos with disabilities. I'm going to meet a ton of different people, and they're going to have a ton of different new words. But if I can keep adding to that list, and it can be a resource that I take with me from session to session to session, I'm empowering a community now to say, okay, this is the way this gal used this word. I hear you using it a little bit differently. Help me understand what you mean by this. So those are some things that I think we could really do in our communities and our supports to support individuals and their families living with disabilities. That works also for, and I'm going to leave this to Oscar because he's the professional in this who I think is going to really drive this home. But that helps the individuals supporting those with disabilities. It helps our staff. It helps our staff to have that same empowerment.
Regina, thank you so much. So many takeaways, and there are moments that I'm connecting to my own life. If you know me well, or you were at Anchor, I am a world traveler, but that world traveler almost always comes with some sort of hospital visit. So when I was in college, I was studying at the University College of London, and I was sick, and I didn't want to call home, and I didn't know what to do, so I went for weeks not feeling well until I finally got a hold of my dad. And this was way before the day of like text messaging and easy communication overseas. And my dad's like, "You do realize it's free to go to the doctor there?" And I was like, "No, what are you talking about?" I'm like, "I don't think I have the money to go to the doctor." So, like, even remembering simply that our healthcare rather systems are not universal across the globe. I think it's just, I'm in a country where English is the predominant language spoken, and I still wasn't getting access to the healthcare. Come later from that lesson, I was in Bolivia a few years ago and ended up getting a really bad case of hand and foot disease while like being in a very remote location, and got some of the best healthcare I've ever gotten in my life. But all of it was done through Google Translate because my Spanish is elementary. I do as best as I can with it, but I certain, like you were talking about, Regina, was not able to be the best self-advocate without the introduction of those tools. And I think what we're sharing today is just really smart to remember that when we think about universal design, that these are things that can also serve us when we are experiencing things, if we're part of the majority culture in a particular place, that we can take it with us when we go somewhere else to serve our needs. So definitely really important. And as you alluded to, Oscar is the HR like mega person on our panel today. So we're going to move and pivot a little bit here in the conversation. And Oscar, as you have shared, too often bilingual staff are asked to do like more than interpret. They become the formal cultural brokers, the trainers, the translators, and the problem solvers. And so what I would love to be able to engage in at this point in time is kind of taking a look at, like, from the employee perspective, what toll does this take on staff, and what is the role of leadership in ensuring that that type of work, the formal cultural broker, the trainer, the translator, and the problem solver, is really valued and shared and is created in a sustainable way?
Yes. Thank you for this question. I think this is the core of our grant and the efforts that we're working towards at this point. I think it's a really important one to address because reality is that multilingual employees are often our unsung heroes of the organization, right? If you go to a hospital, you see medical assistants or nurses that are translating and may not even be compensated for that work, right? You go to other places. I know Regina alluded to children translating for their parents. I remember being 10 years old and translating important documents for my parents. So I think when we're talking about employees that are multilingual in the workplace, not only do they translate, but they do often become the face of the organizations for those clients they're serving. For example, at Options for All, one of our programs, community engagement, you work 3-to-1 ratio. You work with not only the family, but the client as well. So by just being able to have someone who understands the culture, speaks the language of the parents, imagine the level of care that we're providing to these clients that oftentimes, or data or disparity data reports that Hispanic or Latino or Spanish speaking clients often receive less services than their English speaking counterparts. So by increasing that representation in the organization, I think that just benefits the organization. It benefits the employees, which I'll actually allude to in a little bit. But I think something that really stuck to me is something that Regina brought up during our first meetings when we met, is that these members of our team, they don't just bring their skills, they bring their lived experiences. So I want us to sit with that, especially, I know this is a safe space in the environment that we're currently living. Our direct support professionals, they are out in those communities, right? They can be empathetic, they can communicate the level of care that we want to bring to our clients. So they know our communities better than we do, right? So one of the ways in which we recruit here at Options for All, and we try to stay in touch with the community, is by using the employment promotora and client promotora model. So we go out to the community, we stay in touch with community partners, and that is the way that we go out and provide information to the families, right? So even if the family may not be a exact fit for our programs, our client promotor is there. Even if the candidate is not or does not meet the requirements or the qualifications for the job, our employment promotora is there to answer those questions and kind of be that friendly face and being there for potential candidates. So I would say that the relationship starts there, the support starts there. Even before you become an employee of the organization, you're already meeting with someone who speaks your language, who understands what you're looking for. When they come and do the interview process, right? Meeting a friendly face that can interview them in Spanish. I forgot to mention what my role here at Options for All is earlier, but I am a bilingual recruiter. So I am that person that conducts the interview, the initial conversation fully in English or in Spanish, right? They have the option of choosing. And I think that's where you can start supporting employees since then. To answer the second part of the question, I think what can organizations do to fully support? I think organizations need to shift from a model of reliance. So just, relying on the employee to translate, relying on the employee to do the cultural brokerage between the community, to placing that responsibility, creating it a shared responsibility, right? I think they need to be adopted as a core function of how we operate as an organization. So some of the examples of that could be like investing in training, investing in hiring interpreters, professional interpreters if needed, right? Building systems that are sustainable, that are going to stay there. One of the things that we pride ourselves on here at Options for All is, although we are working through this grant with, that grants expire, right? So all of the lessons learned, all of the systems that we've created in place, they're going to remain at Options for All. So for example, our HR team, we hired our payroll specialist, someone who's able to answer questions fully in Spanish to meet the needs of both our English and Spanish speaking staff, right? You have a friendly face that you can send an email to, pick up the phone and call them and, hey, can you help me break this down? Some of the things that we also, as at Options for All, as we shift to becoming a fully bilingual organization, we've also we translated hundreds of pages from our employee handbook to the forms that our candidates need to fill out when they get hired, to doing check-ins with our teammates in Spanish, right? And that is an option they have. So I think there are a ton of things and there's a lot of innovative ways of supporting our employees. And I quite frankly, I would say that, organizations that fail to innovate may fall behind, right? The demographics of this country are changing rapidly. And as George alluded to, Regina, we all have kind of talked about the same thing, right? Our demographics are switching. Our grant is focused primarily in Spanish, but this model can be replicated to many different cultures, many different languages. So I think the way we see how we can better support our employees is crucial, and adopting those as part of our core functioning is probably my main takeaway message here.
I appreciate that. And I hope that our panel will appreciate that I'm going to change some of our questions up solely because we have some more organic flow in certain places. So I will clue you in, and glad that you were able to take a sip, Oscar, because I'm coming right back to you. So, what you are really talking about, right, is building systems into your organizations where people feel seen, heard, and valued. And we know that that really equates to trust, right? And we know that trust can't just be expected, that trust has to be earned. And so, what does trust building look like between supervisors and a multilingual staff? Are there things that get in the way? And like, how do we create that kind of environment where people want to stay in this role?
Yeah, no, this is another important one. I think when I think of trust, I also think of, or another word that comes to mind is belonging. To me, those two go hand in hand. But for me, the trust building starts with when a supervisor starts showing, not just a supervisor, but all levels of management, teammates, they start showing up consistently, listening, following through, and just creating a safe space where staff can create themselves, right? So this means, for your staff not having to code switch. I've been in places, and this is just my lived experience, right, where I don't even say that I speak Spanish, right? Because I want to code switch and feel like as an immigrant, right? I had to do that when I came into the country, right? So thankfully at Options for All, we're trying to create an environment where our staff can walk in and be speaking Spanish, right? You go to the office, you talk to our HR representative in Spanish, and there's no need to have to, kind of struggle to get your words out or expressing your thoughts. I think, George, you brought up a great quote where, and I'm probably going to not say it exactly how I said it, but when you can't communicate, you lose access and you lose your identity. How powerful is that, right? So I wouldn't want that for our staff to feel like they're losing part of their identity. When I interview candidates in Spanish and they're like, oh my gosh, this is amazing. I feel like I can communicate better. I think better in Spanish. as an immigrant to this country. I often feel the same. There's words that I struggle to find the meaning of, and I just say it in Spanish. I'm like, you get what I'm saying, right? um, I think this may be a side anecdote, but this reminds me of when I moved to the US and I was in middle school. So often, the kids would make fun of the ESL students for speaking Spanish in the classroom. So I think it kind of relates now as an adult, right? When you create an environment where your staff can still feel safe around others, I think that's part of the trust. That's part of the I feel like I belong here. And by association, I feel like that's where your staff would want to stay. They'll want to be part of that. I think part of the question also talked about the challenges, right? I'm not going to say that it's been a not a bumpy road, because reality is that when communication goes only one way, everything gets lost in translation, communication policy, you name it, right? So I think but there are a lot of things that work in our favor. So I think at this point, we do have a lot of innovative technology that allows us to communicate in real time. We have translation, we have AI, that's kind of like coming in to help. So I remember during our last all staff meeting, we had the ability to through Teams use the live translation. And I just turned it on just out of curiosity, just to see what it would look like. And it was pretty accurate. So I can only imagine being a staff that cannot communicate fully in English, because we didn't have a Spanish version of our all staff meeting, but we had that translation, and it was a game changer, I would say, right? So I would say that with trust comes support, comes belonging. I feel like they're all are intertwined together.
Yeah.
And again, that would be my other takeaway.
Thank you so much. And I think that actually brings us back to one of the points that George really wanted to talk about. And one of the things that I have said often since coming into this disability space from education is the amount of people who start their careers as DSPs and stay long term and become C-suite level executives is like unlike anything I have seen in any other industry I've come in contact with. And so when George and I and all of us were talking about this, we came up with the point that too often DSP roles are seen as temporary or low skilled, especially if you're part of a multilingual staff, or you're that person who is multilingual. So the question we wanted to pose is, what if we treated these roles as a foundation for long-term careers? And what strategies could employers implement to promote upward mobility for individuals who are highly skilled, like George and the friends that George introduced us to earlier in our conversation? So, George, what are your thoughts? What can we do as organizations to be like, hey, this is your starting point, but we see a future here for you in health and human services?
Yeah, that's a very good question, Sasha. And I think I can relate to this myself. And, I recently, just a little bit of story. I just came recently, I visited Uganda, and there, as you all know, there are hundreds and thousands of immigrants, the refugees from Congo who've been there for decades. And one of the things they suffer is just like lack of all kinds of necessity. And some of them were very well off back home in their country, and now they're living in the refugee camp where they live by $10 a day or a month, actually, I should say. And so when I came back here, and we had the meeting of the council, the owners council, and we were talking about workforce shortages, and you realize that like 8,000 miles away from Uganda, you're talking about people who have no job, and hundreds and thousands of them. Here we have a work shortage, and one of the industries that suffer here in Maine, for instance, that suffer the work shortage is healthcare and also construction and hospitality. And when we talk about healthcare, we think about IDD, also business and organizations. And one thing that we had to do, and I think we have not done a good job, is just trying to see people are coming here and coming to us and looking for jobs. And you all have heard about brain drainage, and people are migrating from countries are experiencing conflict and highly skilled people and young people are coming and finding jobs for us. So, and one of the things that I think we should do is really developing systems that support them and welcome them. And Oscar mentioned about belonging. If you don't belong, you don't stay. How do we make our organizations, our corporations, very friendly and welcoming to a point where somebody comes in and start as DSP and they all start thinking about growing within the organization and becoming the next leaders. And I've seen people here or organizations being very creative and some of them providing ESL classes. So if they can't have no infrastructure of providing ESL there, they can also give some benefit. And we had a meeting where people were talking that we can offer benefit beyond just health care, but also the 401k. We can offer also some English acquisition benefit and supporting in a very meaningful way of acquiring the language. And from there, they will see like this is an organization that has supported me from the beginning. When I started as DSP, didn't know anything. Now I've become a leader, becoming a director, and growing and even own your own business within the industry. So I think if we can intentionally assess the background of our staff and see their potentials, their background, their education, and then starting creatively having more benefit, not necessarily the ones that are traditional, but also the ones that are non-traditional, meaning like meeting the needs of DSP that we have. And that will be a huge asset or huge help. And we can also support guiding, acquiring the certification, the credential they desperately need. If I'm here and I'm an engineer and I'm starting as DSP, how would that be so good if I've been supported by my agency to get certificate or license to start practicing as an engineer? That's huge. And you can rest assured that word of mouth within the immigrant community works so very well that they will talk about the ages that help them to, grow within, even transition into their own career outside. So, and the other thing that we can provide is just like provide a little bit of a leadership development. There's nothing that works better than being supported by somebody who's lived the experience. And I've seen it over and over when they come to my office and some of them are my colleagues back home who just came and when they realized that I went through a lot of horrors and struggled, and yet I was able to survive, and not only survive, but maybe thrive, they can easily relate to that. And when they are being supported by somebody within the organization who's lived it, you can't have better than that. So those are really some strategies that we can use are very helpful and I've seen works. And if we use them as leaders and create some policy, how do we assess our policies that we have within our programs and see how they can fit the needs of DSP that we're supporting or we're employing right now? And how develop new programs within organizations that support DSPs. Those are very creative initiatives we can take. And I don't think it's a very hard one. So, we can look for resources that are, I've seen people writing grants about providing ESL, and there are grants out there that can support them. So it's just a matter of intentionally thinking and creatively planning on it, and then developing programs that fit the need of DSPs. And from there, they can grow within, and also, if they happen to go outside the field, it's not a loss. It's again because we're also feeding and being a foundational of professional careers into other programs and other businesses. So there's so many ways we can be creative. And I will challenge every leader who's here today to do the same. Look at your policies, look at the programs they have, look at the benefit package they have. If you can include other the benefit that will fit the needs of your own employees, I think they will appreciate it, and your organization is going to stand out as an organization that has supported people who had no support elsewhere.
I really appreciate you sharing that because as we think about, the immigrant community, one thing that is always historically proven true is that most people don't immigrate by themselves, right? And when they arrive into the United States, they find people where they can feel like there is belonging in community. And if your organization establishes a really strong reputation as a place that's great to work, you will see those work shortages start to um, decrease because there are more and more people who might be willing to go to you rather than working at a fast food restaurant because you're offering an investment in somebody like an ELL teacher where they know they're going to get the benefit, right? So I think it's what is the short-term creative investment that really generates that long-term tie into the community that you've been talking about, and I think is just so important and maybe something I think that we all need to pick up that challenge. And to that end, though, you don't have to do it by yourself. Regina, you are really passionate about the role of community-based partnerships, especially in what they play when it comes to supporting multilingual workforces. So, how can all of the people who are inspired today to like be creative and do better and help create less of a demand when it comes to their workforce needs, to work with community-based partnerships? And how can organizations avoid, in trying to do this work, tokenizing those partnerships and instead really building meaningful and mutual relationships between their service organizations and our community-based partners?
Well, thank you, Sasha. I think that one of the first pieces that we have to put at the forefront of this thinking is to recognize that we are creating partnerships, we're creating relationships, right? To think about that when we are reaching out to community-based organizations, that we are not creating a subordinate. And so I say that a little bit with a little bit of joking, but I think it's true. Like sometimes we can come in there like, you're going to work for us. We need this from you. And in reality, what we want is we want a partnership. We want a collaboration. We want them to be someone that we are, to be an organization that we support their values and mission, and we ask them to support ours. And so I think that starting with community-based organizations is a wonderful way to really start to make sure that we can maximize on what we have going on. For example, the Promotora program that Oscar's referred to, creating a partnership with an organization like the Promotoras is huge because, like he said, they know those communities intimately. They are living, breathing, and for many, experiencing trauma together collectively as a result of navigating systems or going through processes. And so creating a relationship with organizations that have that trusted relationship with communities is huge, because one of the things that we have to remember is that many underserved communities have a common experience of experiencing trauma, right? They have a common experience, and I'm not saying at what hand or whatever, but experiencing trauma, whether it's trauma of not having adequate water, whether it's trauma of coming from, a country that has experienced violence, whether it's trauma from being a mom who is experiencing for the first time navigating a system with a child with a significant disability, right? All of those layers of trauma. And when we have community-based organizations that have worked really carefully and intentionally at developing safe spaces, like Oscar talked about, having a safe space opens the door to not having to code, opens the door to feeling empowered to be able to say what is truly going on and what the real true needs are. When we have those relationships with community-based organizations, we have the opportunity to present quality interventions, quality supports, quality services, and we have the opportunity to support our staff, to recognize that our staff, many of our staff are coming from places of trauma. And so are we finding some supports for them? Are we finding some as Georges and Oscar both talked about some ways that we can empower them to grow, ways that we can empower them to obtain, health literacy, English literacy. Are we empowering our staff so that they will feel that sense of belonging, that sense of ownership to our organization, and want to stay with us and want to grow with us and want to be empowered to do the job that they're charged to do? So I think that's really important to recognize that the reality is that many of our community-based organizations, as a result of some changes that will be happening nationally to system infrastructure and financial infrastructure to provide services, will be charged with really trying to fill those gaps where needed. So when we can find some creative ways where we can empower organizations, even if it's through helping an organization to have some supports that they need to help their organization infrastructure be strengthened, because we all come with assets. We all come with some things that we can contribute, some gifts that we can contribute. Talk to an organization and figure out what they need. Do they need help with some policy development and maybe some support in running their boards and commissions or whatever? Can we bring that gift as state organizations to empower that entity, and then ask them in return, can you help our staff? Can you help our staff to be partnered with some peer mentorships of some people in your organization who can help them to learn English and really be able to launch into the English language? But also really taking the time. Sasha said something at the beginning that I just keeps rolling around in my noggin here. And that is, don't ask if you can Google it, right? And so if we can take the time to empower ourselves to learn about communities without putting this burden of asking communities to be re-traumatized over and over and over again by telling their story. But if we can take the time to understand the history and to understand the experiences, even if it's not a national experience, even if it's an experience in the community. For example, the community in Denver, the Latino community in Denver, has been displaced over and over and over again. And that re-traumatization of gentrification in our communities is traumatizing. Our communities are like, well, actually, we're not going to do that, because every time we invest in a community-based organization, we get pushed, and our community-based organization is now 100 miles away from us, and now we don't know where to go. So it's really understanding what's that historical perspective of the communities that we're working with and the staff that we're working with, so that we empower ourselves to understand where people are coming with, meeting them where they are, meeting with them with who they are and the experiences that they offered. And as we start to learn more and more about that, we'll start to find the right words to ask a person in the right space with the empathetic cultural humility muscle, strengthened cultural humility muscle, to bring the empathy to the forefront, to say, tell me about your experience and how I can best support you. How can I best support you? Because now I know that we want to work together, and you're going into a situation where English is not your first language, and you are now charged with supporting somebody whose first language is English and their family. And there's cultural dynamics and cultural conflicts that are happening because you want to check out for 20 minutes a day to have a private time to be able to pray. Well, let's educate each other on what you're doing. Let's educate each other on what you need. Just as a person living with a disability who you're there to support wants to feel connected to their spiritual existence or their, whatever is soulful for them, your staff want those same kind of things. So self-education, cross-education, and working with teams. I also think it's really important to pair up new staff with veteran staff, right? I think that's really important to do, so that new staff aren't just pushed into new dynamics and new situations, and veteran staff can come in with tools and resources and say, this is what helped me. It may not help you, but I want to offer this as a suggestion. And then having check-ins, regular check-ins with your staff is so important to do. As I talked about in the beginning of our webinar, this is true for your staff. If they come from a culture where there's a hierarchical dynamic that is just part of their cultural norm, coming to you and challenging you with questions doesn't feel culturally safe for them. And so they need the invitation. They need the invitation by leaders to say, I want to check in, find out how things are going and how I can best support you. To what did Oscar say? He said, helping you to invent yourself and become the true identity of who you are, I think is so amazing, because that's exactly what we're asking our staff to do, is to invent who they are in this position, and to be able to have the fluidity and the flexibility to do that in a way that marries their cultural existence and their cultural identity with their professional existence and their professional identity. And I think if you asked all three of us, that's probably where we all feel like our jobs help us to thrive, is we get to show up as our true and authentic selves.
Regina, that is really sitting with me in a number of ways. And folks, she didn't know she was doing this plug for me, but I'm just going to follow up real quick as I give them time to think about their key takeaways and give you time to put your questions in the chat. I know some of you put them not in the chat, in the Q&A rather. I know some of you did put them in the chat, but if you could transfer them over so I don't miss them in the Q&A, that would be really helpful. So the first thing is trauma-informed care is absolutely essential. And if you are interested in upping your game, even if you've had an introductory level, I do want to invite you to join us next week for a 3-part series all about trauma-informed care that Anchor will be hosting on Tuesday, Wednesday, and Thursday at this time. So you can find more information about that on Anchor's event website. The second plug I want to do is hello, Anchor has an award for these community partners that Regina is talking about. I'm going to put the link in the chat, but we recognize them every year at our annual conference, also known as Anchor Connect. And so if you have somebody that you are building this type of relationship with and want to honor and recognize, these are the stories we want to hear about. So please take the opportunity and the time to check out that awards program. And then last but not least, before we begin to sort of wind down and wrap this all up, as you all are talking, I appreciate, Regina, the call out to what I will give my mother credit for, who's 70 years old and started when we were on this journey, was if I can Google it, I shouldn't ask you, right? And I was like, that's a great line, Mom. I'm stealing it. Um, but we've talked about a lot of trauma today. It is okay if you are not like me, a former African history teacher, and you don't know about what has happened in certain parts of the world. It is okay if your knowledge about what has happened in this country to Indigenous people over time is limited. It is okay if you have never traveled outside of your local town or the United States. But one thing that you can do that selfishly for both you and your organization can make you look like a rock star is that when you invest in knowing people, right, and where they come from, do a little bit of research about recent history that they might have lived through that are designated days as trauma. So imagine going to a New Yorker who has lived through 9/11 and not really paying attention that September 11th is not a day that maybe they're going to bring their whole self to work. And the more that you can do to educate yourself about where those moments are, the more you become that empathetic, knowledgeable leader who doesn't need to make their employees relive the trauma in order to honor their experience on those days, right? And so just even knowing to give a little space in those moments is huge. Or maybe you're an organization that says, hey, I know you haven't talked to me about this, but I imagine today's a tough day for you. What can I do to support you in this particular situation, right? That's the power of owning your own learning and the power of having access to so much information. So that would be my one big takeaway from today's conversation is there's a lot you can learn on your own in order to support your employees by just taking some time to be curious. George, what do you want the one takeaway to be for all those who chimed in and stuck with us listening today?
Thank you, Sasha. And so here's one thing that I want, whoever was able to participate today to take away or to walk out with is here at Serenity Residential Care, when we started back in 2018, and started employing more people from the immigrant community, we quickly realized that the materials that we use, like Regina said, are not really adapted to the level of understanding of our DSPs. And you all know that, you have to take the CDS classes and like 73 modules, like more than 60, and you have to do CPI and you have to do CRMA. And when you really dive into those materials, they're heavy and loaded and with terms that probably are non-existent to some of the DSPs that we use in their own languages. So what we did was really looking at, but yet we know at the same time that the health and safety of a member that we serve are very important, and we cannot afford to compromise with them. And so what we did, we took extra time and dive into the materials and really simplify them into a version and adapted the language to our DSPs so that at least the high level of health and safety of our members are guaranteed. And we've started from training, like retraining every staff that we have. And you were talking about over 200 staff, and making sure that one-on-one or two of them, three of them, coming down and sitting down and walking them through the new materials that are simplified, easy to understand. And at the end of the day, they just feel empowered to go out and do the job. And that is like base or line or infrastructure that helps them to even understand the bigger concept from there. And what we realized that sometimes the staff will say yes to avoid just embarrassment, not because they understand the concept, but just you're there, you're asking them a question that you think they should know, and they just say yes, just to avoid that moment of embarrassment. But yet when they go home, they realize, okay, I had no idea what they were talking about. And I've sitting in my own experience where we had a meeting and we're sitting there and people will laugh and you don't even know what they're laughing at. You just also laughed because you don't want to sound ignorant when you don't know even something that we talked about. So really all leaders and supervisors who are here, look through the materials that your DSP has been using. Are they adaptable? Are they grasped by your staff? And look at ways you can really simplify them, and by taking key elements of the materials and retrain your staff. That's number one. The other thing, like mentorship, we did not talk about mentorship. The people, once you've engaged with your DSPs and your staff, and you get to know where they're coming from, the trauma they've experienced, and how they survived, and how they're here, and what are the issues they're experiencing every day. And then you try to be part of it and say, in the scheme of all the issues they're experiencing, what can I help you? Is there anything that I can help? It could be just about taking 30 minutes of your time and sitting with them in a very neutral place and engage them in English and say, I'm here, I speak good English, I'll be your person that you can run to when you're struggling with anything. That, if I wish I've had that person from the beginning, maybe I would be way far from where I am now. If I had, but and one of the things I realized, American people are very polite and they would try not to offend you by saying you made mistake by saying this. This is not how you say this. You should say this. They just try to be nice and let you go, and yet you're making mistakes and you don't know you're making them. And at the end of the day, when you're facing tests or exams, you're not gonna pass because you don't know them. So by taking time and mentor somebody that you're employing, it would be huge support from them. And the other thing that I see, like a peer help, like you see the ones that I think Regina, you touched upon somebody who's like a veteran, so people who've done it before, who've survived some of the situations that within the programs. Like how do you couple them or pair them with somebody who's just starting up and say, hey, I've been here for the last 5 years, and this is how I've survived, and this is how I got to know this, understand these things. So by knowing who's struggling and who's not struggling, and put them together so they can learn from each other because they are there anyway together. So by intentionally developing those programs, I think it will be a huge help. And I can go on, but I don't want to take much
I
other and
appreciate that, but it definitely resonates. When I came into this field, there were so many acronyms. Donna Martin was my buddy, and she was like, "Hi, Sasha, let me just tell you what this means," like in every meeting, in like a private conversation, and it was great. But ultimately, over time, we've just adopted here at Anchor that the standard practice that we try not to use acronyms at all, so that there is no confusion when we're talking to each other. So I think that's been a wonderful cultural shift I've personally experienced. And again, think about it, English to English isn't always great. Like we have to acknowledge that. And so when we expand beyond that, we can think about how much more complicated it can get. Oscar, what's your one major takeaway that you want everybody listening to this call today to be thinking about when they leave?
I changed mine actually from as we were all speaking. So I think the broader theme that I would walk away with is accessibility. As we try to make announcements, communication, just making it accessible and available to those who need it. Regina, I think you definitely hit it right with making our documents like a fifth grade level. Like it's making me think of my job posts, my job descriptions. Are they at a level where anyone can really understand them, right? So I would say that for my takeaway, working with a multilingual staff, when we think about it, like we wouldn't expect someone to go to like a bank and sign a loan agreement in a language that you don't understand, right? You don't go to the doctor and you get instructions on how to take a medication in a language you don't understand. So why should we expect our multilingual employees to go over important conversations with human resources, important conversations with their manager about their performance in a language they don't understand, right? So accessibility, accessibility, accessibility. I think that's my huge takeaway.
I appreciate that. We don't have time for it today, but when I see you next, remind me to tell you the story about me renting a car in rural France. It is always a laugh generator, but is a great sign that it's not just language, but also visual cues that are included as part of plain language, because sometimes images are easier to translate than words themselves. So something to think about. And Regina, what's your final takeaway that you want this group before we dive into questions in our last 10 minutes together?
Well, I think that and this is probably just coming from the work that I do in really community innovation, community support. I think it's important, and I'm really thinking about Jeff's question, and I'm thinking about the physical connection that we have to Georges. Like he has this person here that has this wealth of knowledge, and figuring out a way like how can they be in community together, and how can they work together and service the communities that they're serving. And I think that that's part of what I think is so important, is to recognize that this work is hard, and that it takes ongoing commitment, it takes sustainability built into infrastructure, and it takes constant innovation, but I think what is important to recognize is that I feel like just having been a part of this group to come to you today and to talk with you all today, I feel like I have a new community in Sasha and Ali and Oscar and Georges. And I hope that you all do too. And I hope that you recognize that we are all available to you via email. You can find us on our website. You can contact Sasha. Have conversations with us, invite us into your communities, and then allow us to be part of the work that you're doing, because it's so important that as we are working on these initiatives, that we recognize that there are evidence-based practices that we can reference and that we can shoot over to you. But there's also your own personal needs, your own state-specific needs that you need to be able to talk through. And if you want to invite us into spaces, and I'm sorry if I just made that invitation for everyone, leave it to me. I think that's important to do, because I think learning from the ins and outs and the things that worked and the things that didn't work from Georges and from Oscar and from myself and from Sasha and from Ali are important for you to learn from and for you to hear from. And I do say that with the selfishness of that, then I know that I'm going to ask you some questions and I'm going to learn from you. And so it's an opportunity of community. And I think that's important for us to have that takeaway and to recognize that, we are at a time right now where community is even more important. And community is something that we really have to rein in, and we have to support one another. And so I just want to thank you all for sharing space with me.
Absolutely. And I could not agree more. I think the first thing in the question was, can we get the speaker's information shared? It will be part of your email Wednesday that will give you also your electronic copy of this. And we will post this. You absolutely can have the ability to share it as well, but we all learn from each other. None of us are an expert in what we do. And one of the greatest tools that we have is when we engage in thoughtful, curious conversations with one another, and know that that's why we're entering into this space, is to ask questions and grow and be curious about what we can do better. One question that has definitely popped up, though, not just from Jeff, but others throughout the course of even preparing this, is there's a lot of concern that's been brought up that individuals who have intellectual and developmental disabilities are already struggling to communicate with individuals whose predominant language is English. And so sometimes there is this sense that how do we balance the support of individuals who are learning English with making sure that the individuals who are asking for supports and services are not getting the best services possible as a result of a language discrepancy. So certainly a question asked. Oscar, I saw you shake your head a bit. Would you, or George, the question was directed to you as well, with you being from Maine, would either one of you be willing to answer this question?
Yeah, I can. That's, like we talked, if the language is a barrier, and then the things that are going to fall in the crack, like one of them is like the individual not feeling supported because they can't communicate with the DSPs. And that also boils down to what we said in the beginning. When you know that you need a workforce, you need DSPs, and you have people who are willing to work, and what do you do as a leader or as an agency to make sure that you're increasing quickly the English proficiency to a level where they can start communicating with individuals. That's where we have to be intentional in trying to create those programs, create adjust policies, and provide more benefit, like a non-traditional benefit to staff, to DSP, so they can quickly acquire the language, the English they need, so they can use to the benefit of the individual that we're serving. And I'll tell you one of the problems. So when people are coming here and they need a job, and they're pressured to provide for their family because they have family to support, they have kids, and then they don't have time necessarily to go to ESL, and that can take a long time for them to acquire English. If there's any way we can create programs that support them while they're taking English, so that they not necessarily have to make a decision either to work or to go to ESL. So those are the areas where we can provide, I think, the service. I mean, we can provide the benefit to the DSP so that they quickly acquire English. And I'm telling you, they are willing to learn English as soon as possible because it's to their benefit. I'll tell you one of the stories that I share. When I came here, I realized I could not even, like, there are things you don't even have access to. Like, let's say you go into a medical appointment and somebody has to sit there where you're sharing the private information with somebody who may be a member of the community, and you don't know if that person can share the same information that you don't want anybody to know in the community that you belong to. And anybody would like to learn as quickly as possible English so that they become more independent, more powerful, more like all the things that we've talked about that comes with not learning English. So a little bit of support that we can provide to them will quickly bridge the gap between the lack of communication between individuals who are being supported, but also the DSPs who are providing services. That's what I can say. and more
Yeah, well, I think it also goes back to what Regina was saying about plain language documents, right? That makes it easier for everybody who is involved in the communication and the communication expectation. We also often only think of adapted technology in one way. So, like, there's all sorts of adaptive technology that can be used through your phone or other more affordable devices that can allow. Does it slow down communication? Yes. Does it increase the ability to communicate? Absolutely. So maybe it's rethinking that standard of what is an accurate response time when we need to remember that folks may be translating through multiple languages, but you can still get there if you give each other the time and the space to slow down what are traditionally fast-paced American conversations compared to a lot of the other world.
And
Oscar,
the other thing that I can quickly say, Sasha, sorry, is that
no.
we have to make sure that we're matching stuff with the individuals. If you know you have a program where there's a one individual who's have high functioning, who's able, who want to be, have somebody they can talk to, and I think you should not match with them somebody who can't communicate. And we've seen in our program adjusting, making sure that whoever is saying anything in the program is somebody who at least fits the needs of the person that you're trying to serve. So that's also something that we can do within the organization, and why we're trying to increase the whole English proficiency to everybody.
I appreciate that. So we've reached 2:30. I'm happy to give you, Oscar, that last note if you want it, or we can wrap up. Which would you like to do, my friend?
I think we're okay to wrap up. I was going to plus one a lot of things that George mentioned. One thing actually before we wrap up,
Sure.
a lot of our DSPs when we hire staff that speak Spanish, I have yet to hire a single DSP who has said, I don't want to learn English. You know, we're all at different levels of I'm still learning English, so we're all at different levels, and by giving staff the opportunity, a lot of them are very grateful, and they start, like as George mentioned, right? So definitely meeting the community where they're at.
Well, I appreciate you all. I appreciate the time that you've given into this conversation. We're already hearing on our side such wonderful feedback. So thank you, everyone. If you have questions, again, we'll send you out further information next week. And I'm so grateful to all of you who took the time today to join us. And until next time, thank you, and we bid you adieu. Bye.